Solutions to foot and ankle pain in New York City. What if I told you that you can continue wearing those pretty high heel shoes or designer flip flops and even run and play sports without suffering from any foot and ankle pain? Learn the secret techniques a professional football player and a ballet dancer stumbled upon during physical therapy. For centuries, women have had a love affair with shoes. If you look back in time to early Egyptians, they used different types of leather and wood products to make women's shoes fashionable. And if we fast forward to the late 1960s and 70s, platform shoes and stilettos made a big impact in the world of women's fashion. And as time went on, the heels have gotten even higher and skinnier. It has been said that women and their shoes cannot be separated. But how has it become that women can balance themselves, even run with heels on? Well, I have heard from more than one source that some women would practice cleaning their house in a pair of high heels just to get their balance just right, so when they go out, the chances of taking a flop decreases drastically. This is absolutely amazing. And what about those flip-flops? In the Northeast, and especially here in New York City, during the summertime, the amount of women that wear flip-flops to and from work or even at work increases tremendously. From a male perspective, we just don't get it. I guess we haven't changed much since our prehistoric ancestors. But from a medical perspective, the implications and even the plain physics of these shoes create a consistent attitude among the medical community to dissuade many women from wearing the shoes they love so dearly. But why can I say with such authority the opposite? And what can you learn from a football player and a ballet dancer? Well, let me give you a little backstory of who I am. My name is Dr. Joseph Simon, and I am the owner of Manhattan Physical Therapy and Fitness Centers, and the founder of the Fitness Therapy Training Systems here in New York City. Our centers have become famous for using the latest techniques in sports rehab and treatment of the urban athlete. I have been practicing physical therapy for over 12 years, and I have seen all types of injuries, including a variety of injuries to the foot and ankle, from your classic ankle sprains to plantar fasciitis, Achilles tendonitis, posterior tibial tendonitis, heel spurs, fractures, cosmetic surgeries, the list goes on and on. But a common situation we see in the majority of our clients is a recurrent or never healed ankle sprain. The most common reaction when someone tweaks or twists their ankle is that they just take it easy for a couple of days. Most think, hey, I've done this before and it healed up by itself in a couple of days. I must admit, though, I am guilty of this too. I know what you must be thinking. Yeah, but you're a physical therapist, so you know exactly what to do. And I would say, yes, you are absolutely correct. But like you, sometimes life takes precedence over what you think is a simple ankle sprain. And I too have neglected the correct treatment for my injury. But the difference is, when I finally do smarten up, I'm able to treat myself for up to 10 hours a day. Also, with the know-how of certain fitness techniques, I can make sure to avoid the reoccurrence of this injury for years to come. But let me explain. The problems that are created from a simple ankle sprain go even further than you might expect. Studies in the American Medical Journal and the Journal of Orthopedic and Sports Physical Therapy have both concluded that 28% of the population with an untreated ankle sprain could lead to long-term issues with your knee and lower back. 46% show chronic knee pain, and a whopping 62% with hip and back pain. The best part? Most people, including some doctors, don't relate the injuries together because they are just responding to the pain that you are complaining of at that time. Matter of fact, I asked a few of my friends and colleagues in the medical field to chime in on this. You can see those interviews on this site as well. So what studies have confirmed, and from what I have seen in the clinic over the years, is that neglecting one spot of your body, especially if it is a load-bearing joint that is used on a consistent basis, does create a multitude of problems going from your legs to your lower back, basically going from one joint to the next. The end result? 1. Muscle imbalances. 2. Possible knee injuries, which might require surgery. 3. Lower back pain, which could lead to sciatica and possible surgeries. So what I have learned from a football player and a ballet dancer that can help your recovery from a foot and ankle injury is that if you work strengthening your feet from your ligaments to your fascia, you build up from the floor up. Now this makes perfect sense if you have an injury that is left untreated. It breaks your body down from your toes to your back. So if your base foundation of your structure is built strong, then we follow the chain. The stronger and less chance of injury to the rest of the body. Now, I'm not telling you to immediately get rid of your shoes and start walking around barefoot. Matter of fact, I'm probably going to tell you to keep wearing them. I might even recommend orthotics, but everything must be on a given time frame and schedule, from wearing orthotics or to start a barefoot training program. So what's the solution, and how can someone like you really get this fixed? I'm not going to insult your intelligence and tell you that you can fix these problems by downloading an ebook or watching some corrective exercise videos. Here at Manhattan Physical Therapy and Fitness Centers, you will meet with a New York York State licensed physical therapist and a fitness expert. We've had years of education and training in physical medicine and rehabilitation. We are also the only clinic in New York that have certified Red Cord therapists. Now, with most of these injuries, I can give you an exact date of when you will be discharged from rehab. Matter of fact, while during an evaluation at one of my clinics or fitness centers, my team can size up your injury along with your body type and create a plan that would take you from screaming pain to running and participating in the Urban Olympics of getting across 34th Street during rush hour traffic. As a matter of fact, we want to get you better as fast as possible. But I have to warn you, if you think I can fix you by tomorrow, then this program is not for you. Our programs are designed for you to work hard and achieve full body results. We need to fix your ankle, but everything is part of that chain. Our goal is to get you feeling and looking good. If you played a sport, we want to make you better at that sport. We will set a time frame and treatment goals so you'll know exactly when you will be at 100%. But be wary of other physical therapists that say they can do the same thing. Saying and doing are two different things. And that's why we are the only physical therapy clinic that offer a worry-free guarantee. If after your second visit you feel you're not getting the care or results you think you can get somewhere else, we will refund your money back with no questions asked, no hassles, no worries. And to answer the question stated before, can someone like me, who might be out of shape, sit at a desk all day, wears heels, or play sports after work, really be fixed? The answer is yes. If you are dedicated to our program, we can fix you and even make you better. I've always told my clients and patients, nothing feels better than fixing someone's injuries and then showing them that they can be better. All it takes are some small tweaks and a lot of hard work. The good news is that we accept most major insurance plans. And for those that don't have insurance, more good news. We have created affordable health investment plans so that you can get treated now and pay later. So call 800-754-0488 to schedule your appointment today. I look forward to meeting you and welcoming you to our team.